By now, your child will have been diagnosed with Kawasaki disease. It's an inflammation of the blood vessels of the body, and this is why it causes the common symptoms of a high temperature for several days. May have red eyes, may have red fingers, red rash around the trunk, or red throat and sore red cracked lips. Quite often the children will have a single large gland in the neck which can be detected and seen quite easily. The problem with picking up Kawasaki disease is because not all the symptoms will occur together, and so as parents you may have seen a rash occur at one point and then it disappears, and then the red eyes come another day and the red fingers come another day. We don't see the peeling of the fingers until much later, so by the time you get peeling of the fingers you probably missed it. So the important bit is to pick up the temperature early on. Certainly in a young baby, if a child has got a high temperature which has gone on for several days and there is no obvious cause for it, then you should think Kawasaki disease. So your child has been diagnosed with Kawasaki disease. Hopefully they've now received intravenous immunoglobulin, or IVIG, which is given by drip, usually in the back of the hand or in the arm. This will damp down the inflammation and is given in conjunction with high-dose oral aspirin. You would ask for an echocardiogram to be performed in the first few days, or perhaps even before the diagnosis is made. This is a heart scan. This is where jelly is put on the chest and the doctors can look at the heart of a child with Kawasaki disease. This is important because some children can have a heart involvement in Kawasaki disease which might change the management. After the intravenous immunoglobulin medicine has been given over a period of about 12 hours, the temperature should settle. Your child should become much happier, much more chirpy, much more cheerful, and start to return to normal. Sometimes that doesn't happen and the child may need extra treatment. It may need some steroids given to them, it may need a second dose of intravenous immunoglobulin, or even more complex treatment such as steroids or other medicine to be given by specialist advice. Blood tests are the first test to be performed on a child. These will look at markers of inflammation and how the Kawasaki disease is affecting the blood cells in the body and the liver and the kidneys and other organs. Also a heart scan will be performed, an echocardiogram. This allows the doctors to look at the heart to see how the heart is reacting to Kawasaki disease. Sometimes other tests will be performed, such as ECG, electrocardiogram, where the sticky leads are placed all the way across the chest. This allows the doctors to look at the heart rhythm and to make sure that there's no abnormalities of blood flow to the heart muscles. Other tests are usually not performed in Kawasaki disease, but obviously may be indicated in specific cases. The coronary arteries may be affected by Kawasaki disease. Just as you see red rash and red eyes, this is just a marker of soreness in all the blood vessels in the body. The coronary arteries, the arteries to the heart, are also blood vessels, and so they can be affected by the inflammation of Kawasaki disease. A coronary artery aneurysm is where a particular coronary artery has got a swelling in the middle. This means instead of being a nice fine tube taking the blood to the muscle of the heart, it's become inflamed and sore and swollen, and this can interrupt the blood flow of the muscle to the heart if it causes a clot, for example, in that particular area. So much of the treatment is aimed at damping down that inflammation to reduce the tendency of the aneurysm to occur, or if it has already occurred, in order to minimize that swelling, to minimize the damage to the heart muscle. The coronary arteries can be inflamed and they can be just sore, and when you do the heart scan you see the lining blood cells of the coronary arteries are bright, and this tells us that they're affected by the Kawasaki disease, but they haven't yet dilated enough to cause coronary artery aneurysms. Sometimes you can get a little bit of swelling, but not much. We tend to call that a dilation, and only when it gets over certain predefined criteria is it actually called an aneurysm. So it just gives us a guide as doctors as to how bad the coronary artery involvement is, and also gives us a guide to how likely it is for there to be problems in the future for your child with their heart problem. When we look at coronary arteries, we measure the size of the coronary artery, but of course you would expect a small baby to have much smaller coronary arteries than a big 10-year-old. So in order to standardize the measurements of the coronary arteries, we relate the size that we're actually seeing on the scan to the size of a normal child of the same age and the same size. We can compare the two, and we use this comparison a Z-score. So a Z-score of 0 means that you've got absolutely average coronary artery size that's not too big nor too small compared to an average child. And if it's Z of +1, +2, +3, then it means it's bigger than the average, and how big it is tells us how badly the coronary arteries are affected by the Kawasaki disease. As you know, the effect of Kawasaki disease can affect any part of the body. We may see red eyes, rash, glands in the neck, sore throat, we may get changes in the fingers. Therefore, it's not surprising if we see effects in any organ of the body. We can see effects on the tummy. You may get tummy ache, diarrhea and constipation. You may see effects on the liver, effects on the kidney. So it's important that the doctors look out for all the different problems that can occur. However, most of the effects on the other parts of the body are only short-lived. So apart from the effects on the brain, which can cause behavioural changes, the child can be moody, can have temper tantrums, can have night terrors. These changes, however, tend to settle down, and we generally see them no more than 2 years after the initial Kawasaki disease. Really, the only long-term effects we see are those that are in the heart, and that's why the heart is, of course, the most important organ in the body, but we look very carefully at the heart and make sure that the long-term effects can be managed properly. If your child did not have any coronary artery involvement at all, we think that the likelihood of a heart problem in the future is very small. Certainly we have not seen in the UK any child who's never had coronary involvement run into problems in the longer term. However, unfortunately, this isn't true for everybody. We know that about a quarter of children who've had Kawasaki disease have had coronary artery involvement, and therefore we would like to follow them forever in clinics, maybe infrequently, just to make sure that there's no long-term problem. It's not surprising that those children who've had the largest coronary artery aneurysms, those who've had the worst coronary artery problems, are more likely to run into longer-term problems, and they will be watched more carefully. They may have specific tests to test the blood flow to the heart muscle, exercise tests or scans in the future to make sure that the heart's healthy and can stay that way. If you would like further information, please see the Societi website, which will be given after this talk. You should also contact your paediatrician or your GP, and they should be able to access more information for you. There's plenty out on the internet, but be careful. As you know, many internet sources aren't reliable, so make sure you go to a recognised, reputable UK source of information in order to pick up that information which you need to help manage your child, and the Societi website will give you that. The side effects of immunoglobulin, luckily, are very uncommon. However, you do have to remember it's a blood product, and therefore we're only giving it to people who really need it. And the doctors make sure that the immunoglobulin is carefully screened in order to minimise the side effects of transmission of any unwanted viruses. Aspirin itself is a commonly used medicine in cardiac children, and we know that it can cause tummy upsets, so we like to give it with an antacid. It should be taken with food in order to minimise any problems of sore tummies. If your child is on aspirin, it's important to remember that the purpose of this is to keep the blood thin. Therefore, if your child does bruise themselves normally, playground activities, then there will be a bigger bruise than normal, and sometimes we see children in the clinic with bruises up and down their legs. And it's important to remember this is a common side effect of being treated with aspirin therapy. As a parent, you want to make sure that you're fully informed and you want to read information about Kawasaki disease, and this can be freely available on the website as we've shown at the end of this talk. It's important also to ask your paediatrician questions that may be troubling you. For example, can Kawasaki disease come back again? This can occur. Only about 1 in 50 children will get it again, but it does happen. We also know that some children who've had Kawasaki disease will go on to have mini episodes over the next few months. They may have, every time they get a cold, they may get red eyes, or they may get a bit of a rash, or they may get peeling around their fingers, and that's well described. Often parents worry because the child seems to have a weakened immune system because they get terrible temperatures and terrible symptoms each time they get a cold. This is common after Kawasaki disease, and it's because the immune system is overactive, and so rather than having just a bit of a temperature, you have a very exaggerated temperature. This does not necessarily mean you need further treatment for another dose of Kawasaki disease, but it just may be your natural response to infections as they occur.